Ready? Okay. Hi, I'm Kennedy Johnson. I'm an occupational therapy student at the University of St. Augustine, and today I'm going to be simulating my role as an occupational therapist who is going to be delegating tasks to my occupational therapy assistant, or my OTA. This is Rowan, and he's here to help me today. Okay, so first things first, I have done a thorough chart review for Maya, which is our client. She is having difficulty with handwriting, so I determined that the ETCH assessment would be the best assessment for her. One, because she's 8 years old, I believe, and for the ETCH, you can use it for grades 1 through 6, so that is within Maya's grade range. And then it also focuses on handwriting legibility, their endurance, if they get fatigued, being able to make out their legibility, things of that sort. So I picked the ETCH for us to use with Maya. So I would just want to let you know what my role is as the occupational therapist, and then I'll tell you what your role is as the occupational therapy assistant. Okay, so first things first, I'm going to oversee the assessment administration, so making sure that all standardized procedures are being followed, and if at any point her parents have any questions, parent or guardian has any questions about the evaluation process, then I can answer those questions for them. I'm also going to interpret the ETCH scores. So I'm going to look at her legibility, her speed, her spacing, and her alignment. I'm also going to try and determine what some of her underlying causes are, and why her handwriting is the way it is, and why she's struggling with it at school, and being able to participate in fine motor tasks. So I'll look at those causes. I'm also going to develop goals and the intervention plan for Maya. So once you and I come together at the end of the evaluation, I'll write those goals in the intervention plan for her. And then I'm also just going to make any other recommendations that could benefit her in her at school or in any of her other settings that may be appropriate to help her with fine motor task and her handwriting. So now I want to talk more about some of your roles as the OTA. So first things first, you're going to administer the ETCH, but I need you to make sure that you're following standardized instructions. So can you repeat that back to me? Make sure that you administer the ETCH. And provide standardized instructions. Standardized instructions. Yes. So basically, by us doing this, it just keeps the validity of the test. We want to make sure that we're doing it exactly by the instructions without any additional cueing, just so that we're keeping our tests valid. It's also appropriate for you to time writing task. So repeat that back to me.
It's also appropriate to time reading task?
Writing task? Yes. You can also make observations of Maya's performance, so any of those are okay to document. You can observe Maya's performance. And document those. Yes, correct. You can also score her assessment, so it's totally fine for you to go down the subtests and add up the scores, and then I'll interpret her score I'll interpret the score of her assessment. So you can score raw data.
I can score raw data.
Correct. You can also document observations like grasp, posture, fatigue, behaviors.
I can
document
observations
such as grasp, posture,
fatigue,
and behaviors.
Good.
let's see. So we want to avoid any type of interpretation or clinical conclusions because that's my role. I will definitely use any of your observations that you see when I'm interpreting Maya's score, but I don't want you to make any clinical conclusions. Say I cannot make clinical conclusions.
Clinical conclusions.
Good job. Okay. You can assist with documentation of the observations that you see. That's kind of what we talked about earlier. Do you have any questions about your role as the OTA? And do you understand your role and my role and how we can better help Maya? Okay, perfect. I am looking forward to a successful evaluation of Maya, and we'll come together once we finish her assessment. I'll take in your observations and we'll come up with a plan of care for her to better her with her handwriting and her fine motor tasks. Thank you.